So when should parents consider bringing their children to a chiropractor?
Well, actually, even before they're born. I mean, I think that all women should be under chiropractic care prenatally. It helps them with a better quality of pregnancy and a better quality of labor and benefits of the adjustments. A lot of times the women in the first trimester, I mean, they feel like $1,000,000. There's no morning sickness, no nauseousness, none of the typical things, low energy. And second and third trimester, a lot of less low back pain, and they just have a vibrant energy and so forth, and you feel like their quality of life has improved being under chiropractic. Well, the adjustment itself is to allow the body to have a normal function with the spine and the nervous system. And basically the spinal column, as we know, as we went through college, it's a protection to the spinal cord, but eventually the nerves have got to go out and go to every muscle, organ, and tissue in the body. And that controls the function because the brain is sending its message from the brain down the spinal cord through the nerves to every muscle, organ, and tissue. And so the alignment of the spine allows for the nerve to function at its highest level. It's a connection of brain function all the way through every tissue of the body. Falls and tumbles all the time. And so having your children checked on a regular basis, actually what you're trying to do is prevent an accumulation of strains to their spine. Because really the first 10 to 15 years, this is where all the growth and development is beginning to happen. And as a result, when you start intervening and having your wellness checks with your chiropractor, you're allowing him or her the opportunity to take the strain off of your child's spine so they can develop healthy, as close to your normal as possible. And so that's why many parents will elect to go have ongoing checks with their chiropractor. Doesn't mean you're going to have your child adjusted with every visit, but regular checks, basically what we're trying to do is evaluate whether or not your child over the last few weeks or month or so has accumulated a lot of stress and falls and tumbles to their spine, and if so, what needs to be done to take care of it, the chiropractic. Imagine a child, the first year of life, almost 50% of them accidentally get dropped from one level to the next. And it doesn't mean they're hospitalized, but that could have been a trauma to their spine. Watching a child standing and falling, they're landing on their rear end, and they jam themselves, and that's like a shocking system. And then when they learn how to walk, you watch them run, and they hit everything low, and they've got this big black and blue bruise right across their head. Remember, maybe with your little ones, and they get hit. So all these little traumas can accumulate, causing subluxation. Well, a lot of times too, a parent will tell me, well, gosh, if I bring my child in to see you as a chiropractor, are you going to use the same techniques as a big person? Well, no, what we're going to do with a patient who's 200, 300 pounds is different than we're going to do with a little baby who's 8 pounds. And so your doctor adapts a technique for the needs of the patient.
Does an adjustment hurt?
Absolutely not at all. But sometimes we might touch an area that might be tender. And so when I share with a parent, particularly after a child's had a trauma and it's tender there, we'll mention that maybe it almost feels like a touch of a bruise. But for the most part, if you're doing wellness care, it's not uncomfortable whatsoever. What's interesting is that you'll have some individuals come in for relief care, symptomatic care, but there's another kind of practice, and that's the prevention wellness care, where I've been practicing just about 25 years, and I've had the children who started from birth on never developed these symptomatic pictures like bedwetting and colic and asthma. And so one of the things we want to do as chiropractors is grow a wellness family where we prevent illnesses and disorders happening with the body. And those who are having functional problems try to bring the best in their life as possible. Receiving chiropractic care and being very healthy and a strong immune system, I realized that, when you would look at adult problems, and you would see that the adult problem somebody's manifesting at age 30, 40, or 50 really started when they were young in life. Well, when should we start chiropractic care? It's like dentistry, you start young. Basically, a lot of health insurance is sick insurance. So if your child has a specific problem, then it might cover it to a certain degree. But many family wellness chiropractors actually have family wellness plans for a family. So it makes it very affordable because you're conscientious and you're following through a wonderful regimen with your chiropractor. So you should ask when you enter an office whether or not they have a family wellness plan. Year number one, they see different changes, but sometimes by the second, third, and fourth year, they just notice, our family's been healthy. Our quality of life, meaning people are sleeping better. I mean, our child is doing better in school. Maybe they were having learning issues, ADD, ADHD. Maybe they saw some results in that area. But it's just the overall family functions better. And then they learn more about how to stay healthy on a nutritional end, using balance of exercise and so forth. And so their quality of life improves because quite often their family chiropractor is sharing a lot of information with them that they're not going to get at other doctors' offices. So as chiropractors, what we do is we work on the function of the child. And by that, sometimes we get extremely positive results. I mean, if you go speak to my parents in my practice, they'll say, you know what, my child used to have asthma, and as a result of chiropractic care and improving the function, those symptoms were gone within a short period of time. Somebody's healthy, that vibrates out to difference in relationships. I mean, if you've ever had a really crummy day because you had a crummy headache, you had a bad attitude. And so you can change everything around, and children have a sense of well-being. They love to be adjusted because they know innately or inborn to them that they feel different, and they know that they're operating at their highest level. A great place to get started would be to look at the International Chiropractic Pediatric Association, and it's over 2,000 members worldwide. And everybody could go to the website, which is www.ICPA4kids.org. A great referral base and a place to, to sign up for ongoing email information to be as well informed as a parent and so forth.
Oh, that's a great resource.